We will try to work some of these bills, if we can, that are non-controversial and people don't have amendments. We will work them the same day to get them off our plate. So it'll be the will of the committee that does that, but I just want to give you a heads up on that right away. Again, we have a stacked agenda for the rest of the week, and if we can get something worked that's non-controversial and you don't need amendments to it, let's just get them off our plate. So with that, I'll open the hearing on HB 2039, amending the definitions of Kansas Credentialing Act. Carly, thank you for being here. And Conferees, thank you for being here, and staff too.
Thank you, Mr. Chair. Good afternoon, committee. House Bill 2039 amends KSA 65-5101, known as the Kansas Credentialing Act. Subsection C2 lists what is not considered to be a home health agency. That includes entities that are not reimbursed by Medicare Part A and only provide services of persons licensed, or certified under the Physical Therapy Practice Act, persons listed under the Occupational Practice Act, and persons licensed as speech-language pathologists. House Bill 2039 would take effect on July 1st, 2025, upon publication in the statute book. And I can stand for questions.
Committee, are there questions? Seeing none, you must have done a great job on that. Okay. First, we'll start with proponents. I have Stephanie Underwood. Is she virtual? All right, Stephanie, are you there? Can you hear us?
Hey,
John.
Chairman Carpenter, yeah, she said she's on, but she can't hear anything, so.
Maybe she has her microphone turned off.
She might. Okay.
Stephanie, can you hear us?
Laptop audio
Yeah.
turned off.
See.
I mean, we're putting on audio.
Okay.
Well, let's move on to Tara
We'll work on that.
and get this worked out. John, if you would. Tara, are you here? Tara, welcome to committee.
Hello, Mr. Chairman, members of the committee. I am Tara Mays with the Kansas Hospital Association. On behalf of our 121 member hospitals, we just wanted to chime in and say that we support the ability of the folks in the physical therapy, occupational therapy, as well as speech language therapy to be able to bypass the credentialing process. For those of you that aren't aware, there is quite a process to be professionally licensed in the state of Kansas. And I know you all in this committee hear a lot of bills about the topic of licensure, many of which you'll be hearing this week. And licensure is one step in a process that we hear about at our hospitals. It's the first step in a process, actually. So you have many compact bills before you this session to shorten up that licensure timeline. However, there's lots of steps after the licensure timeline. A medical professional, after they get their license with a regulatory agency in the state of Kansas, must then go to get their DEA license, which takes a few weeks. Then they have to be insured in the state of Kansas through the Healthcare Stabilization Fund. Then they go to our hospitals, and we have internal reviews from our medical staff for that professional to be able to work. And then we have a process called credentialing, which is what this bill before you, House Bill 2039, deals with. We hear from our hospitals that credentialing is a significant significant barrier to professionals being able to practice in the state of Kansas. For our hospitals, we are hearing that it is currently taking somewhere between 90 days to more than 120 days to get a professional that comes to a hospital seeing patients. And that is a significant barrier where we are paying that professional and they are not seeing patients. So when you're working this bill in House Bill 2039, we would just certainly say we support the bill, but as you're looking at the topic of credentialing and how to get people practicing medicine quicker in the state of Kansas, we would like to offer to you potential language to be able to ensure that that process is sped up in the state of Kansas to at least 45 days, or at least be able to go back and be able to bill for those services that are provided by those professionals in the state of Kansas. So with that in my written testimony, you have potential language for an amendment, but we would also just urge you to, as you're looking at streamlining administrative burdens in the healthcare industry, bringing down costs in the healthcare industry, and increasing access to care in the healthcare industry, we would urge you as you work House Bill 2039 to consider adding language around credentialing more broadly. With that, Mr. Chairman, I'm happy to stand for questions.
Committee questions? Representative McDonald.
Thank you, Mr. Chair. Tara, do you know why it's taking so long? Is there a backlog? Do they need more people? Is 45 days reasonable to ask of them?
Yeah, we have heard that there's a backlog. We feel like 45 days, as we look at states that have gone through the process of putting statutory language in place, 45 days is what's pretty standard and average. It's what we were seeing several years ago, so we feel like that's a pretty good timeline to be looking at.
Representative Turner.
Thank you, Mr. Chair. So your testimony is basically kind of pointing to the whole process of credentialing. And you've taken this bill as the opportunity to say, hey, why don't we expand it to all these things? Have you talked to the bringers of this bill, which I think is Fox, the lady that hasn't yet testified? I mean, are they okay with you blowing up their bill or doing that?
We certainly don't anticipate, we don't want to blow up their bill, but as you look at the topic of credentialing, we certainly want to highlight that there's a need more broadly, not just these particular professions, but more broadly than that, to be able to address the topic of credentialing.
All right. Thank you, Mr. Chair.
Representative Blex.
Thank you, Mr. Chair, and thank you for that. And my wife and I went through that crazy, ridiculous stuff about 3 years ago. She moved from Suite B to Suite A, just the same building, and they wanted 90 days to have to recredential the whole stuff. We actually got the person who owned the clinic building to change the letters on there in about 2 minutes compared to this 120-day delay that is really cumbersome. I thank you for that.
Yeah, thank you so much, Mr. Chairman. We certainly want to say not just professionals coming to the state of Kansas, but any professional serving in the state of Kansas that even switches locations to be able to serve patients has to restart the credentialing process, and it is certainly a barrier to care and an administrative burden.
Committee, further questions? Seeing none, thank you, Tara.
Thank you.
For being here. John? Is she? Stephanie, can you hear us? Stephanie, are you muted on your end?
Can you hear me?
We can now.
Maybe you're hearing, maybe I need to, hold on 1 second. Can you still hear me?
Yes, we can.
Can you hear me now?
Yes.
Oh, shoot.
Oh, we can hear you. Yep. Stephanie, we can hear you.
And she can't hear you.
Enter your ID followed by. You will now be connected to the meeting. This meeting is being recorded and
Okay. Hi.
Can you hear us? Now, she can hear us, so what do I need to tell her?
You need to unmute my cell phone.
You're
There
fine
you
now.
go.
Okay,
Okay.
stay with us.
You can hear me. All right. I'm just hearing feedback.
I think
All
we're
right.
good.
Good
to go.
afternoon. Chairman Carpenter, Vice Chair Bueller, Ranking Member Ruiz, and members of the Health and Human Services Committee. My name is Stephanie Underwood, and I'm the General Counsel for Fox Rehabilitation. Fox is a Medicare Part B provider of outpatient physical, occupational, and speech therapy services in the homes of older adults in 36 states. We're not a home health agency. We serve complex patients. Our average patient is 82 with multiple comorbidities. We fill the gap for patients who are not homebound but need outpatient therapy and have difficulty or no desire to go to a traditional brick and mortar clinic. We provide our services in patients' homes. Across our footprint, 60% of those services are provided in assisted living facilities, and the other 40% are in residential homes. Within assisted livings, we partner with, as a subcontractor, with home health agencies and provide the therapy services for their patients. For patients who aren't homebound and are eligible for Part B services, we provide those directly. We're looking to expand our operations in Kansas to be able to conduct our house call model. Kansas's current statute regarding home health services appears to include outpatient practices like ours that provide therapy in the home. So we're proposing a clarification to the statute that would allow providers like Fox to provide its services as allowed under the Medicare Part B regulations relating to outpatient providers. We have the support of Phoenix Home Care and Hospice, who has provided written testimony, and Via Christi, two of the largest home health agencies in the state. And we've spoken with and provided information to the Kansas Physical Therapist, Kansas Occupational Therapist, and the Kansas Medical Society. I'm open for any questions. I appreciate you taking the time to listen to this matter and hope that you will support our legislation to open access to care for older Kansans.
Very good, Stephanie. Committee questions?
Thank you.
Orpeza.
Thank you, Mr. Chair. Thank you for your presentation. As a former representative has already asked, would you be open to the amended language that's been proposed by the prior conferee? Did you hear any of that?
Would I be proposed to the language that's been proposed now? Yes.
Sorry, I don't know if she's hearing me completely.
And Stephanie, I'm going to jump in real quick here. We'll talk with the Kansas Hospital Association and Tara about that language. I know it's quite expansive, and our focus was on this to allow them to continue our work here in Kansas, but we'll talk with Tara afterwards.
Okay, thank you.
Representative Bueller.
Thank you, Mr. Chair. So the question I have is, how many people in the state of Kansas could you serve if the statute was changed? I don't know if you could use a neighboring state as an example, but how many additional people could you provide care for? Thank you, Mr. Chair.
Well, thank you for the question. We can provide services to all Medicare Part B beneficiaries in the state that need the services that are eligible. I don't have an exact number, but that's what we'd be able to provide the services to. As well as manage, if you're on a Medicare Advantage plans, we would treat those patients as well.
Representative Miller, do you have a follow-up? You good?
No, Mr. Chair, I'm good.
Representative Steens.
Thank you, Mr. Chair. Can you hear me?
We can.
Yeah, I just have really more of a comment. I know a question and a comment. I know in the questioning, like some people were questioning about the credentialing, but my understanding is they were just trying to take out some of the language so that they were deemed as a home health agency. And then my comment is, I have worked outpatient Part B services myself, And I'm a very big proponent of this. There's a lot of patients out there that can be served by this. I used to treat a lot of lymphedema patients, outpatient on this in their homes or assisted livings and some independent livings. Thank you.
I have a hard enough understanding just one person talking without 3 or 4. What is going on? Are you able to control this?
I can do from my end. They have audio coming in from their side that's also being picked up by the computer, so it's all just.
So do they need to turn their audio down?
So she's called in through her phone, which is hearing all the audio in the room.
I called in through my phone, but my phone doesn't seem to be unmuted. You guys, the video was unmuted. But I can't hear through the video. That may do it.
Is that better?
Representative McDonald.
Thank you, Mr. Chair. How many states do you operate in currently?
36 plus DC, including DC.
Committee, further questions? Okay. Thank you, Stephanie, for your proponent testimony. Committee, I'll bring your attention to written only from Alex Malugin, President and Partner of Phoenix Home Care and Hospice. I think, committee, that we probably won't work this bill today. We need to study that amendment a little bit better. It sounds like the two folks need to get together and come back to us with some potential solutions to this. So with that, committee, further discussion. We'll close the hearing on 2039 and we will open the hearing on 2217. And the first proponent, Jenna. Thank you, Jenna.
Thank you, Mr. Chair, members of the committee. House Bill 2217 expands the power of Jenna Moyer, Office of Revised Statutes. House Bill 2217 expands the power of the Inspector General to investigate and audit all state cash, food, and health assistance programs. I don't know if this sounds familiar to you. It is very similar to a bill that came out of the Senate last year. I believe it passed the Senate floor as Senate Bill 488. So I'll be pointing out a couple of the differences as we go along. Section 1 amends KSA 757427, and it provides definitions for terms used throughout the bill. The first of those is cash assistance, which essentially references TANF for temporary assistance to needy families, as well as food assistance, which is generally referencing the Supplemental Nutrition Assistance Program, or SNAP, and those two definitions are consistent with their usage in the Social Welfare Statute 39709. Then there's also a definition of health assistance, meaning the Medicaid program, the state children's health insurance program, and the state employee health benefits plan, and it gives you the statutory reference there. Subsection B states that the Inspector General's purpose shall be to establish a full-time program of audit, investigation, and performance review to provide increased accountability, integrity, and oversight of the state's cash, food, or health assistance program. Subsection B to B states that the Inspector General shall not be employed or a former or current Inspector General shall not be employed as an executive or manager for any program or agency subject to the oversight by the office for 2 years after the Inspector General's period of service has concluded. Subsection G states that the Inspector General and his or her designees shall have original jurisdiction to investigate crimes related to public assistance. They'll have the power to issue, serve, or cause to be served subpoenas or other process of service in aid of investigation, the power to compel by subpoena, the attendance and testimony of witnesses directly related to those assistance programs, the power to administer oaths and take sworn statements, and the power to serve and execute in any county search warrants relating to investigations being executed by the Office of the Inspector General. And when I did the comparison between this bill and last year's Senate bill as it was introduced, the main difference was last year's Senate bill had an appropriation for additional employees. I believe that this year that is being dealt with through the appropriations process, not through this bill. And I will be happy to answer questions.
Committee, questions? Representative Ruiz.
Thank you, Jennifer, for the explanation. I have a question on page 3, line 32. I think that's the first time where we see the phrase "and other illegal acts." Do you know what that means? Can you define that?
Yep, there's not a definition of other illegal acts in the bill, and so it would just be whatever the Inspector General recognizes as illegal under state or federal law.
Thank you.
Representative Opesa.
Mr. Chair, thank you for your explanation, Jenna. My question is on page 5, line 23. Is there a definition of significant levels of fraud? It says specifically, upon finding credible evidence of significant levels of fraud. Do we have a definition for significant?
It is not defined in the bill.
Thank you.
Representative McDonald.
Representative Oropeza had my question. Thank you.
Committee further discussion. Representative Turner.
Thank you, Mr. Chair. What was that Senate bill again? I didn't catch the number on that.
Last year's bill was 488.
488? Okay, thank you.
And that bill was amended by both the Senate Committee and Senate Committee of the Whole, and those amendments are a little different than what's in here as well.
Sorry, those amendments are included in this bill?
No, they're not. It's generally the as introduced version minus the appropriations.
Thank you.
Representative Opesa.
Thank you, Mr. Chair. And I hope this is the appropriate time. Since this isn't the Judiciary Committee, do you have an explanation on how subpoenas work? Like, does that go to a judge first, or?
It would depend on the type of subpoena, but generally it would be the law enforcement body, in this case the Inspector General, would send it to the, let's say, the health insurance company, and just asking for those records. And then they would be required by law to send them back.
I have a follow-up. So there's no checks and balance. It would just be the Inspector General sending these subpoenas out.
So there could be a opposition or an objection to the subpoena, and then you could get the court process involved.
Oh, okay. Thank you.
Representative Myers.
Thank you, Mr. Chair. Thank you, Jenna. So on page 7, section E and 2, following kind of the idea of the new definition of the health care or health assistance program, am I to understand then that with the strikeout on E, but then the inclusion of E's language in 2, that includes all individual medical records for patients who are clients of Medicaid, S-CHIP, and the state employee health insurance programs such as ourselves, possibly?
Correct.
Interesting. Okay, thank you.
Committee further questions. Representative Weichel.
Thank you, Mr. Chairman. To follow up on a previous question, the warrants that are mentioned in here that could be issued, again, what's the process that would go through?
Thank you, Mr. Chair. Typically, to have a warrant, you'd have to go before a judge, and the judge would have to sign off on the warrant.
Representative Myers.
Thank you. Sorry, Mr. Chair, but thank you. Jenna, maybe I am missing it in here, so my apologies. But is there anything in this bill that indicates like the process or like how the Inspector General would determine which records would need to be accessed? Like what, is it just a general, like inspecting all records to see if there is an incidence of fraud or waste, or would there have to be a compelling reason for the Inspector General to get access to these health records?
So under this bill, the Inspector General would be given fairly broad discretion in order to request those records. There's nothing in the bill that says it has to be related to a specific allegation. It could be a generalized review, but he should be able to talk a little more in detail about those processes.
I understand. I was just trying to find out if there was language instructing, like informing us on how, like if there would be an indication of fraud, if that would be the case, or if there's just going to be a basic broad overview. So to clarify, you're saying that this bill doesn't have any language that would indicate that it wouldn't just be broad access, correct?
Correct.
Thank you.
Representative Rivas.
Yes, Jen, and to the former representative's comments, I think page 5, line 26, there's a large paragraph there regarding Inspector General and access to records that might help. Yeah. Item D.
Representative McDonald.
Sorry, thank you, Mr. Chair. I was kind of hung up on that Attorney General having access to all the files as well. I looked at statute 75-726, and I remember when the Inspector General spoke the other day, he said he's independent of the Attorney General. On page 4 at the bottom, it says all employees serve at the pleasure of the Attorney General. And it indicates on page 5, line 3, that they independently perform the functions of the office. But if we go back to the statute that was referred, 75-726, it says the Attorney General would have access to all records. So I feel, does he have access to all records once a finding is made? Or is that very clear with this?
So that would be on page 5, beginning in line 23. When the Inspector General finds credible evidence of significant levels of fraud, waste, abuse, or other legal acts, the Inspector General shall report the findings to the Attorney General, and that report is how the Attorney General would gain access to that information.
Does it say explicitly that the Attorney General would not have access otherwise? Because I feel like it says the Attorney General can dig through the records anytime, as written.
I don't see any explicit prohibitions in this bill, but I
Okay.
can double check just to make sure.
I just have some privacy concerns, but thank you for that answer.
Committee, further questions of Jenna? Representative Opeza.
Thank you, Mr. Chair. Thank you. My previous representative asked about warrants and then going to a judge, and you said that's how that happens. In this bill, it talks about counties and those types of things. When warrants are asked for, do they specifically have to go to that county's judge? Because there's a little bit different makeup between counties, or is there a certain way that happens?
So it would be the...
Or they could go to, any
Oh,
judge.
sorry.
It's kind of what I'm just like, they can go to anybody.
Okay. So it would be the county where it would be the jurisdiction of the action. So if you're looking for St. Francis, you would have to go to a judge in Shawnee County because that's where they are located at.
Okay, so there is some county-specific judge asking for the warrants.
Yes, I guess in a judicial district where there's a lot of judges, like in Shawnee County, I'm not quite sure how that works, which judge you would go to. But in a smaller county where there's just one judge, we just have the one judge, especially and then after hours, there may just be one judge who's on call to receive all of those requests for warrants in the middle of the night, so you're not calling a bunch of judges at random. It'd be like on call for a doctor.
And I just have one more, follow-up question, Mr. Chair. So what you're saying is that someone from Sedgwick County could not say okay to a search warrant in Shawnee County. Is that correct?
So if the jurisdiction were located in Shawnee County, you would have to go through the Shawnee County judge.
Okay, thank you.
But it would also depend on if you have multiple offices or places where those records are kept. There could be more than one search involved, if that makes sense.
Okay,
So if you had a clinic where there's a lot of different locations, that might have to vary there.
okay, thank you. I appreciate that. Thank you.
Representative Ruiz.
Thank you again, Jenna. On page 1, line 28, that defines contractor, are the MCOs included in that as a contractor?
I'm going to say, yes, that would include the MCOs, because it references specifically the health assistance program.
And on page 2, line 20, it does say managed care program, so that includes all of our 3 MCOs.
Yes, so this bill would include the records of those MCOs.
Okay, thank you.
Committee further discussion? Thank you, Jenna, very much. Okay, next we have Steve Anderson, Medicaid Inspector General. Steve, welcome to committee.
Thank you, Chairman Carpenter and members of the committee. I'm happy to be here today. I am Steve Anderson, the Inspector General, wanting to talk in support of HB 2217. As I've testified previously, the core mission of the Inspector General's office is to detect fraud, waste, and abuse and illegal acts in the Medicaid program. This is achieved through audits, reviews, and investigations. Just as a reminder, the state of Kansas Medicaid program is a $5.5 billion expenditure each year that serves over 467,000 people on an annual basis. I've included in my testimony a chart of the audits we've completed, and if you want to break it down by year, if you look at the number index, the 22 references the calendar year that's involved. The requested revisions to KSA 757427 will also allow the OIG to conduct audits and investigations of the cash and food assistance programs that have a severe lack of oversight. Our goal is to increase the effectiveness and efficiency of those programs to help ensure those entitled to benefits receive them. We have no intention of removing people rightfully receiving benefits. We're focused on making the program work better for everyone. Audits are seldom conducted, and when they are conducted of those programs, the scope is very limited. Federal audits are also conducted in the Medicaid program, but as noted above in our audit list, we continue to find issues that need to be corrected. In my testimony, provide FY 2024 expenditures for some of the assistance programs that we would want to provide initial oversight and audits for. Food assistance, or SNAP, is a $428 million program per year. Serves 103,000 adults and 85,000 children on an annual basis. The TANF program, Temporary Assistance for Needy Families, is a $9.7 million program. And then the Child Care Assistance Program is $84 million per year and serves 13,466 children. Seldom are these programs audited by the federal government, and occasionally are audited by KPLA, but that's done on a seldom basis. We'd like to be able to do those audits. These programs are essential to taking care of Kansans who need it most. However, these programs are often taken advantage of by bad actors. Our goal is to root out the fraud, waste, and abuse and illegal acts of these programs, as we've done with Medicaid. The requested revisions are not intended to supplant or duplicate investigations currently being conducted by DCF investigators of the Food Assistance Eligibility Program. Our agents have the ability to conduct higher level and more complex investigations, and we want to look at contractors, employees, and providers. OIG special agents are currently working subjoint cases with DCF investigators on matters that involve Medicaid and food assistance fraud, so we have some experience already in dealing with this. OIG investigations would seek criminal and civil action for cases involving a significant amount of fraud committed by vendors and providers. Any work conducted by OIG would be reported separately from DCF in our annual report. Another benefit of OIG's expanded authority is handling internal employee investigations of DCF employees. Currently, DCF handles these investigations, which has been criticized due to conflicts of interest. OIG would be able to conduct independent, investigative, internal investigations Our agents have the capability to conduct those investigations, and we'd also be able to have an unbiased review of those policies and procedures to help ensure programs intended to help and protect children are effective in being followed. This committee, as well as the Senate's Health and Welfare Committee, would benefit from the work of an expanded OIG. We currently provide information to the Bob Bethel Committee, and we would be able to provide an independent, unbiased information to these important oversight committees. As the OIG exists today, we've been able to identify over $330 million in fraud, waste, and abuse and savings. By expanding the authority of this office, we can even do more to protect Kansas taxpayers. At the end of my testimony, I have a letter that was dated February the 8th, 2024, from then Agriculture Secretary Thomas Vilsack to Governor Kelly, talking about the SNAP program. And by emphasis, there's a note in there that says, further, according to the most recent state reported data, your performance both in PER and in CAPR are worse. And it's talking about the payment error rates and what have you. And the letter goes on to urge Governor Kelly to basically do a better job with Kansas's SNAP benefits. I like to believe this is an area where our office would be able to assist by coming in and doing a review of that program. I appreciate your time. Be happy to stand for questions at the appropriate time.
Committee questions. Representative Bueller.
Thank you, Mr. Chair. Just trying to read the tea leaves and some of the questions that were asked as the bill was being briefed. What assurances does the IG's office have that you're not out there with either vindictive audits or vindictive warrants, that there's independence with your office and the AG's office? I mean, those are concerns I think I'm hearing from my fellow committee persons. Mm-hmm. So I'm just curious as how you would respond to that.
Sure.
Thank you.
I appreciate the question, sir. First off, we have to have probable cause to do any kind of investigation, or we'd have to have a reason to go there. We are independent from the AG's office in that he does not direct our office. He doesn't have access to what we do. Our office is a healthcare oversight agency, which means that we're exempt from HIPAA. His office is not. So there would be HIPAA concerns right away if he was to want to see records that we're doing. Further, I had requested a change be made to the language to the bill to remove the state employees health plan access out of there. That was a problem last year with Senate Bill 488. We'd like to have a modification done to take that piece out because that is a issue that had came up extensively last year, and we're quite content to have that. We really don't need that to do the cash assistance and other programs. So I would respectfully ask that that be modified out of the current bill.
Representative Blex.
Thank you, Mr. Chair. Thank you, Mr. Anderson, being here, and appreciate your detailed report. Appreciate what you do. I think this is certainly a bipartisan issue to make sure that we're good stewards of the taxpayers' money. And it looks like there's a lot of fraud out there. And we hear a lot about this, but I appreciate you documenting that, and thank you for what you do.
Thanks, sir.
Committee, further questions? Representative McDonald.
Thank you, Mr. Chair. I have a couple questions, but I just wanted to get a little clarification on something you just said about HIPAA and the AG's ability. Can you say that sentence again? You have something he doesn't have?
Right. We are a healthcare oversight agency, and that's where we were immune to HIPAA, which is the Healthcare Information Patient Portability Act.
Thank you. That clears that up. I noticed that you mentioned that you're a certified inspector general, and I just would like a little more information on what that means. And Is this a common thing? Does every state have one? I'm kind of new to this.
You bet. No, not every state has an inspector general, first off. Some states have a lot of inspector generals for almost everything. Florida is a good example of that. I'm required to become a certified inspector general to hold this position. That's part of the statute. If you read the entire KSA 7427, it required me to become a certified inspector general, which meant I had to go to training put on by the Association of Inspector Generals, which I did, and passed the test, thankfully. But that's what it requires you to be a certified inspector general.
Representative Reeves.
Thank you, Mr. Chair. I asked the reviser regarding the phrase other illegal acts, and she mentioned that that was not defined in the bill, which I couldn't find it anywhere. But that was pretty much at your discretion, at the IG's discretion. Can you give us examples of what other illegal acts are and how you would come across those?
Sure. First off, that language has been in the bill since it was originally created. That was restated in here, but other illegal acts has always been part of our statute. But other legal acts can be something as simple as identity theft. We also sometimes get involved in our investigations where there could be a death or some other issue that happens in conjunction with Medicaid fraud, and we would want to have the ability to investigate those or to become part of those investigations. You may have seen in the news, there's a story right now about a child that was found buried, and we are involved in that investigation and helping with that and providing Medicaid information to them. So that allows us to assist other agencies with other types of crimes.
Thank you. And also, on page 3, where it talks about establishing the office, so there's language in here about it being unbiased, sort of independent, correct? But yet, it says here that the office will be under the Attorney General, and that the Inspector General shall be appointed by the Attorney General with the advice and consent of the Senate. So it would have to go through a nomination and.
Yes, we have to go through an appointment process.
Full vetting of the Inspector General. And the Inspector General shall be selected without regard to political affiliation. But then on 4, for me, it sounds contradictory. On 4, line 42 towards the bottom, it says that employees shall serve at the pleasure of the Attorney General. So it doesn't feel very independent to me. When I think about independent, I kind of think about the Office of the Child Advocate, where that seems to be pretty independent. And it was an argument made by the legislature that that office should be made that way. So, but this office isn't.
So let me provide a response, if I may. The Attorney General's office, due to our size, we depend on them for budget as well as HR resources. I don't serve at the pleasure of the Attorney General. I can only be removed for cause. My staff is hired through the Attorney General's office, but I directly supervise each and every one of them. I don't know the exact line number in there, but is in that same paragraph you're working in is where I have the ability to direct the staff and set the office up at my pleasure. So that gives us a certain amount of flexibility that the AG office does not have anything to do with. And I can also assure you that both when it was under former Attorney General Schmidt as well as under Attorney General Kobach, there has never been a single moment of attempted influence or direct who we hire or don't hire for our staff.
Representative Turner.
Thank you, Mr. Chair. My questions are about this duplication of effort. I think back to my business career, and the auditors came in and they had pretty much a list of things they were going to look at. I look at some testimony here and I see that, excuse me, when the feds come in and do their audit every 5 years, they focus on recipient claims, recipient integrity, and fair hearings. So maybe they're just operating to look at specific areas, but in terms of the duplication of effort, your comments were that you do a higher level and more complex, and that you basically accept their work, or at least you don't duplicate their work, and you look in some other areas for fraud and abuse. Is that fair?
That is correct. We would not duplicate federal work. There's no point in it. We know from looking at the Medicaid program, the feds have very specific things that you look at. We look at other areas. These are vast programs with a lot of rules and regulations. There's plenty of other areas to look at. And as I pointed out, even though the feds look at the Medicaid program, every audit we've ever done has resulted in additional findings and wasteful spending and cost savings, or money where money could be saved. And also looking at the list of audits that are done, if you look at some of these programs like TANF and SNAP, and the cash assistance program and foster care and others that fall under this, they haven't been audited in years by the feds or by KPLA. So I think there's plenty of work to be done there, and these are programs with millions of dollars that are involved in it.
Thank you. Thank you, Mr. Chair.
Representative Myers.
Thank you, Mr. Chair. Thank you for being here and providing testimony today. I have a couple questions I've written down. I'd like to start by kind of bouncing off of what Representative Turner asked. So what would happen to the current DCF fraud department if the IG's office were to take on the responsibilities of these other programs?
They would stay right where they're at. We have, they do basically internal, or they do eligibility investigations. They don't have special agents, they're investigators. Theirs are more administrative investigations. Occasionally, they have ones that rise to a level of pretty significant criminality. They're limited in their ability to do those investigations because you need to have sworn special agents to do that, which is what I have. That allows us to do higher level investigations. Also, our focus on the investigations is going to be more toward the provider side. They just look at eligibility of participants. They don't look at the food stamp vendors or the contractors that are handling the program. That's our goal, is to look at those.
Okay, so then what you're saying is the DCF would continue to do fraud investigations on recipients, but the IG's office, you would only be concerned with providers and retailers and things like that?
I wouldn't say only, but that'd be our primary focus for investigations. We currently are assisting them on a few investigations where they don't have the ability to seek prosecution. What happens for their administrative investigations when they do find anything of any significance, they have to basically refer it over to a county attorney to have the county attorney's investigator do the work. We're able to do that for them. We're doing an investigation right now on a case where they would have had to turn it over to the county attorney. A lot of times they don't have the resources or the interest or basically even the knowledge on how to pursue these cases, whereas we do.
Okay. My concern with that is because I'm looking at some testimony from a committee I served on last year, and we had a pretty large presentation on fraud from the DCF and their investigators, and they seem to do an excellent job at rooting it out and responding to complaints. I think in 2023 there were well over 1,800 complaints, but they only found about 225 reputable cases of fraud, which would be less than 1%. I believe it's 0.1% or something. So I just worry about the cost incurred to both agencies to duplicate efforts if that's the kind of fraud that we're going after, since we know that it's really not the recipients or the individuals who receive the benefits. To follow up, though, what would constitute probable cause in this circumstance?
Well, probable cause is evidence of a crime. You don't have to have a reason beyond it. It doesn't have to be beyond a reasonable doubt. Just probable cause, meaning more likely than not a crime has occurred, which would then give us the reason to go in and do further investigation.
Would you mind providing me an example of what you think would constitute probable cause in, say, a SNAP or a TANF case?
Sure. Let's say that an individual who has applied for benefits or maybe is on benefits, as this frequently happens, and the eligibility worker is looking at their case and says, wow, this person says that they have no income or very limited income, but they go and look and they see that they're living in a $600,000 house and driving a new Silverado pickup, and they get information from a caller who says, hey, I know this person, and I know for a fact that they work as a contractor, have their own contracting business, and they're making, $200,000 a year, and they report that. That would give us sufficient probable cause to look further into the matter.
Is that not what the DCF already currently does?
That's what the DCF does. We also have the same problem over in the Medicaid arena. I would be more interested, like I said, on some of those cases, DCF only does administrative pieces of it, and I was at that briefing, by the way, that you were at.
I recall.
They're able to look at it from the administrative side, and all they can do is basically get the person cut off benefits and stop them from getting them and then try to do a recovery. But if the person's a real significant case or they've been on benefits for a long time, that's racked up a lot of money. We did a case with them a year and a half ago where the person racked up about $34,000 worth of food assistance benefits they were completely ineligible for. They would like to have that person charged just so they can go a little further with it. They're unable to do that without the assistance of some outside law enforcement entity doing that for them.
Understood. One last thing. So it sounds like you're already working with the DCF to do what you're asking to have codified within the bill?
We're doing with it on a very limited basis. We'd like to be able to do more, and we'd like to be able to work with them in situations where there is no Medicaid fraud. Right now, there has to be a Medicaid nexus for us to participate with them on a case. That's our authority right now is limited to only Medicaid. We can work jointly with another agency. We can work the Medicaid side, they work their food assistance side. We can put a joint case together and give it to a county attorney for prosecution. If this bill goes through, that would allow us then to assist them on cases like that without a Medicaid nexus.
I would remind the committee that they will ask permissions from the chair as they ask for multiple questions like that in the future.
My apologies.
Representative Weichel.
Thank you, Mr. Chairman. What is the fiscal note that you're asking for through the appropriations process that accompanies this?
We had asked for, and I don't want to get the two confused, we had asked for a enhancement to our budget for purely Medicaid reasons, absent this, okay? And that was for 3 additional staff. There's a fiscal note that's being floated for this if this goes through, and we're starting with 9 FTEs, that would give us auditors, investigators, and analysts.
May I follow up? Okay. I appreciate the conversation around kind of the provider side of fraud or the contractor side of fraud versus the individual side, because I think way too often this conversation leans in the direction of, you know, people are out to game the system or people are trying to cheat the system, where I think in reality, it's a very complicated system. And I was digging through some of the things, and I appreciate that you included the letter from the USDA, because I'll note a couple things. One, it says that we don't have an acceptable application processing timeliness, which is how quickly applications are processed, right? And people don't apply for food assistance because they're going to be hungry in 3 weeks. They apply because they're hungry right now. And the error rate that you quoted that they asked us to correct, I will note, was during fiscal year 2022, which was in kind of the depths of the pandemic when state agencies across the country were scrambling to be able to meet the needs and the volume of applications that people were submitting. So I would be curious to see a more updated overpayment rate. And then one last thing before I get to my question. I was looking through the TransMed or the transitional Medicaid that you indicated in your testimony today and that you talked about last week. And I went to your report and I found this part really interesting about the fraud that you found in the program, that you said, we identified significant compliance and control gaps within the TransMed program. A lack of oversight has led to staff misunderstanding, which has contributed to a 45% error rate within the TransMed program. We also identified a lack in targeted reviews aimed towards resolving eligibility issues related to the TransMed program. What this says to me is that the issue is with the application processing. And it really just makes me wonder if money is better spent investing in state agencies so that they can process the applications in a timely manner, in an accurate manner, because we know when state agencies are overwhelmed, errors happen, mistakes happen, versus kind of trying to go out and catch people after the fact, if that might be. So I'd be curious in your thoughts on supporting increased staffing for agencies to process the applications.
Well, we've actually commented on a few of our other audits that there appears to be a lack of staffing and encourage that. I would also submit, though, that in situations where we can't always make a definitive evaluation of staffing levels, that they oftentimes have policies and procedures in place where they're simply not following them. So, and I think this TransMed audit was an example of that, where if they would have been following the procedures, they may have had a little better luck with the situation.
I mean, I agree. I think we just need to be careful when we're placing blame around people who are trying to access food and healthcare and to be able to meet their basic needs. I think that sometimes there's a narrative out there that it's that person's fault, where I think the state is not always meeting our obligation of doing those applications in a timely and accurate fashion.
Is that a question? Okay.
Representative McDonald.
Thank you, Mr. Chair. I had a couple things. I just want a little clarity. The other day when you were here, you said that you have 10 FTE, I believe, and one of them is half-time. Is that correct? Like just currently?
One of them's part-time.
Okay, part-time. And then a minute ago, I heard you say that you're asking for 9 FTEs more just for the Medicaid. Is that, I've just.
No, ma'am, that's incorrect. I was asking for 3 additional FTEs for the Medicaid only, and if this expansion bill was to go through, then we were requesting 9 additional FTEs for that.
That is what my paper said, sorry. I looked at it wrong. Okay, the other, if I can, I just ask one more question and then I'm done. Okay, we mentioned with the revisor that significant levels is referred to here upon finding credible evidence of significant levels of fraud. That's really open to interpretation, and it's one of the things that I get frustrated with in this place. A lot of times our words are not specific. And so from an intent standpoint, I want to make sure I understand what rises to a significant level. Could you give me 2 or 3 examples? Thank you.
Sure, and that is basically, it's based upon my opinion of what is significant. The original statute did not have the word significant in it. It just basically had me reporting every incident of fraud to the Attorney General that we find, which would be excessive, so we put the word significant in. And significant would be something that would be newsworthy, for example, something that's going to make it to the front page of the newspaper here in Topeka. That would be something he would want to be advised of so he wouldn't be caught flat-footed. So we have issues like that. We did an audit about 1.5 years ago now where we had an interim report coming out about background investigations on schools and school employees. We knew when that hit that that was going to be significant, so I advised the Attorney General of that so that we could be prepared for any public relations questions that might come up, and they did. So that's what we would consider significant. Basically something that's going to be newsworthy. There's a lot of issues that come through it, obviously criminal, but they're not terribly significant or of major level, so there's no point in constantly briefing the Attorney General on all those cases, because as we do more, we are having more and more reports that would come through and it'd be excessive. Does that answer your question?
So am I hearing you say that not everything you investigate goes to the Attorney General?
Not everything gets reported initially to him. We do a lot of investigations that go nowhere. Sometimes, thankfully, we actually disprove the allegation. And I have to tell you something, and when we actually disprove an allegation, that's a win for the person who's being accused to be cleared. So we consider that a successful investigation, but we wouldn't brief the Attorney General on that.
Okay, thank you.
You're welcome.
Representative Bryce.
Thank you, Mr. Chair. Thank you, Mr. Anderson. Appreciate your testimony. I had a quick question. I appreciate you going over some things, describing the guardrails about the investigators and the independence from the Attorney General directly. I think that's important. But the thing that impresses me when I just step back and look at this whole issue, it's the numbers that we're talking about. I think when you first came up, you mentioned $330 million had been identified. Was it what time frame was the $330 million identified?
That's been since I came on board in April 2021.
Okay, so, and did that $330 million basically, was that a positive toward the state general fund or the state budget? Or is this just hypothetical money, or is this real money that we see here in the budgetary process?
Some of it's real money. When we talk about the savings, for example, this year we saved $12 million of state general funds. It'll be a definite impact on the state budget. That's $12 million the state of Kansas will not spend on bed tax. Some of the other money where we talk about overpayments, that's money that we identified that could be recouped, but the agencies decided not to recoup it. There's nothing I can do to compel that. That was the agency's decision not to recoup those overspendings or overpayments to the MCOs.
Thank you.
Representative Ruiz.
Thank you. Mr. Chair, I have one more question. Does the tribe TANF, is that program, is that included in the possible investigations? Is that whole program also included in the bill, in other words?
Yes, Representative Ruiz, it sure is.
Thank you.
You're welcome.
Representative Pezo.
Thank you, Mr. Chair. So I had a question. It's actually back with what you were talking with the Representative McDonald about, how you were able to prove that somebody wasn't taking advantage of the system. What repercussions did that person have?
The person who made the allegation or the person who was under
The
investigation?
person who was under investigation.
No repercussions. Their name was cleared, and so there would be no action taken against them. Oftentimes, they don't even know they were under investigation.
And my follow-up question to that, so sometimes they don't know they're under investigation, and then sometimes they do know and then have to refute that allegation, is that correct?
Sometimes we're made aware of the investigation because we have to interview them, so that makes them aware of it. Other times, we're able to clear their name without ever having to contact them or they're ever being aware that an allegation was made against them.
Okay, thank you.
Any further questions? Thank you, Stephen.
Thank you, Chairman Carpenter.
Committee, I'll bring your attention to written opponents only. Mark, Heather, and Andy. And I'll mention that just so I actually won't butcher Brown, but the other ones, I don't know. Anyway. Okay. With that, we will close the hearing on 2217, House Bill 2217. We will open the hearing on 2280. Carly?
Thank you, Mr. Chair. House Bill 2280 clarifies the authorized activities of paramedics, advanced emergency medical technicians, and emergency medical responders may be authorized upon the order of a healthcare professional, permits certain ambulance services to offer service for less than 24 hours per day, and requires entities using automated external defibrillators to register with the Emergency Medical Services Board. Subsection 1 amends KSA 656112, adding a definition for an emergency medical responder and a qualified healthcare provider. Section 2 amends KSA 656119, stating that after successfully completing an approved course of instruction, localized specialized device training, and competency validation, and after receiving authorization from medical protocols or upon the order of a qualified healthcare provider, a paramedic may perform authorized activities under KSA 656120, 656121, and 656144 and amendments thereto, and may administer such medications or procedures as may be deemed necessary by a qualified healthcare provider. Section 3 amends KSA 656120 and lists authorized activities referred to in Section 2. Section 4 amends KSA 656121 and lists authorized activities referred to in Section 2. Section 5 amends KSA 656129A and lists the professionals that shall supervise a student or emergency medical service provider while such emergency service provider is engaged in a course of training or continuing education approved by the board. Section 6 amends KSA 656135 to allow ambulance services that provide only non-emergency transportation to offer services less than 24 hours a day, every day of the year. Section 7 amends KSA 656144 and lists interventions referred to in Section 2. Section 8 amends 656149A to require that persons or entities that purchase, lease, possess, or otherwise control or acquire an automated external defibrillator shall register such defibrillator with the Emergency Medical Services Board. House Bill 2280 would take effect on July 1st, 2025, after its publication in the statute book.
Committee questions of Carly? Representative Opeza.
Mr. Chair, so I have a question on page 3, lines 5 through 7. How does that differ from the current full practice authority that we passed in 2022?
Mr. Chair, Representative Oropeza, I will look that up for you.
Okay, thank you.
Committee, further questions of Carly? Seeing none, thank you, Carly. Next, we have our first proponent, Joseph House. Joseph, welcome to committee.
Thank you, Mr. Chair, members of the committee. My name is Joseph House. I'm the Executive Director of the Emergency Medical Services Board, your regulatory body for EMS and all things related to that. We are in strong support and appreciate you for allowing us to provide testimony in support of House Bill 2280. So House Bill 2280 is a collaborative piece of legislation in front of you, multi-year project, and coming through and just fixing some technical cleanup items such going through there. There are really no strong policy changes in there. It's just updating things to become more reflective of current practice. So even with like the last section there, that registration advice, currently that's being done. It's being done through folks writing things on this sheet of paper and handing it to the EMS service, the EMS service turning around, handing that to our 911 telecommunicators, and hoping that makes it into an electronic system for them to be able to review where those locations are. The electronic side of that streamlines that, makes it all one, makes those map layers available to all of our communicators across the state from a single location. There's no cost to that registration system at all. We're currently providing it. It currently has devices within it, including several that are within this building, so that you see on the outside of the elevators there. The remainder of this bill really does just fix problems that have been identified to date. And so very pleased with the collaborative effort that we've taken on with the industry and making sure that this bill covers those, addresses those appropriately. I think you'll hear from them next, but we would appreciate your strong support of 2280 as well, and I'm happy to stand for questions at the appropriate time.
Thank you, Joseph. Questions of Joseph? Seeing none, thank you for being here. Next, we have Dave Johnston. Dave, welcome to committee.
Good afternoon, Mr. Chair and committee members. I'll be brief. You have my comments already on hand here. I just want to say this is a very collaborative effort. We have named this bill ourselves the EMS statute modernization. This is just really updating several existing rules that does not meet current practice. I've been in EMS a little over 35 years now. Some of these have been in place since the beginning of that and beyond. So we just went in and updated. I can't answer real quickly on that page 3, item number, was it line 5 through 7, asking about ARPNs. I'll tell you, the term there is new. The qualified healthcare provider did not exist in our definitions before. It's added APRN. It used to have with physician authorization. That's been removed to reflect independent practice within what's been presented. So outside of that, it's been very collaborative. In addition to Kansas EMS Association, we have had positive feedback from all 6 of our EMS councils that reflect the same districts as the 6 Homeland Security regions, in addition to Marker in the Kansas City metro area. So just asking for your support in moving this forward.
Committee questions? Representative Beeler.
Thank you, Mr. Chair. I'm going through your testimony, and I'm in the previous conferee talking about the collaborative effort. I'm looking at a specific example. I would wonder if you would care just to expand on one of them. So, for example, you say examples include allowing EMTs to monitor saline locks, transmit serial EKGs. Could you kind of give us the before and after? So this is why it was a problem, and this is what this will fix. That'd be helpful.
Yeah, absolutely. What existed in some of the statute before were restriction on how practice was actually occurring. So the ability to monitor saline locks, that wasn't clearly defined previously to that. And we have a lot of transfers that go out where the patient simply has an IV lock in them. So they were replacing that with a IV bag of fluid when they didn't need that. Other things were oversights, such as the ability for AEMTs to initiate an interosseous infusion, but by law, technically, they weren't allowed to monitor it, which made no sense. It's just cleanup on things along those lines. There are a few things where you'll see that are strike through in the language, and that's because it also already existed in regulation. There's no reason for it there. It's outlined. So I think nebulized therapy was one of those. It's outlined in our routes, and it already exists in statute, so we removed it from, exists in regulation, so we removed it.
Any further questions? Representative McDonald.
Thank you, Mr. Chair. The Kansas Association of School Board had a suggestion. I wanted to see what you thought about it. On the last page, page 8, line 11, it says, pursuant to the provisions of this subsection, persons or entities that purchase, lease, possess, or otherwise control or acquire an AED to be placed within the state shall register the automated blah, blah, blah. And they were wondering if it might be better, instead of having shall, to be may. Would that impede your
Well,
intent?
and with all due respect, I will say that I can speak on behalf of the industry. The regulatory part, which is specific to this AED, I'll have Mr. House speak to.
Okay, thank you.
Any further questions? Representative Reeves.
Thank you for the presentation. I'm really happy to see that in the bill was the provision about being able to operate while not under the direct order from a qualified, health provider that has to constantly be there. And that was one of the issues, before. So it feels like we've kind of joined the current electronic ability to, to be in contact with the healthcare provider constantly, but they don't have to be physically present.
Yeah.
Yes, modernization, that's right.
That's it.
Committee, further questions? Seeing none, thank you very
Thank
much
you.
for being here. Committee, I'll bring your attention to written-only proponents from Con Olson and Jason White, and a neutral from Leah Flitter from the Kansas School Board Association. With that, I will close the hearing on 2280. Committee, with your permission, I would like to work that bill at this time. Representative Orpeza, did you have a question?
I'm sorry, which bill? 22, we heard 2280?
The 2280
Okay, thank you.
that we just heard. Is there objection? Seeing none, I would entertain a motion. Representative Blex?
Mr. Chairman, I'd like to move House Bill 2280 out favorably for committee.
Second by Representative Bueller. Discussion committee. Representative McDonald.
Thank you, Mr. Chair. Like I mentioned earlier, the Kansas Association of School Boards did have this respectful request that the language on page 8B, line 12, be changed from shall to may. Could we have some discussion on that before we pass it out?
Jenna, or Carly, I guess you were the one. So she's asking to change shall from may on
Page 8B, line 12. Can I make a motion that we change line?
Yeah, that's right.
Is that what you need me to do?
We have a motion for an amendment
Correct.
to
Do you want me to
change the
read-
language. Do I have a second? A second by Orpeza. Discussion committee. Let me look at this. Representative Blex.
If you could, if the reviser could actually give her professional opinion as to what that might involve with changing the word from shall to may.
Thank you for that.
Thank you, Mr. Chair. Representative Blex, that would essentially make it not a requirement. They would have the option to do so, but it would no longer be required to do so.
Mr. Chair, would that be for the entire bill, for everybody involved, or is that just the school board? Am I understanding that correctly?
Mr. Chair, Representative, that would be everyone.
Okay.
I'm uncomfortable with that. Committee, Representative McDonald.
Thank you, Mr. Chair. Could I amend my amendment? Can I make a motion to amend my amendment? A substitute motion. Is that how it goes? Okay, I'm learning. The concern is that campuses.
Hang on. Is it okay? Who second? Is that okay with you? Okay.
The concern for schools is that they're not aware of a registration, like they don't know how, if there's currently a registry. And they worry a little bit about liability and legal exposure if a school were to not list their AEDs on the registry. So could I amend my motion and say something to refer to schools, may instead of shall? Just limit that to schools.
Mr. Chair, could I get I would need some clarification as to what schools, whether it's K through 12 or universities as well.
Yeah, and I agree, and I'm uncomfortable with this at all. So let's just, we've got an amendment ahead of us.
I'm happy to withdraw my amendment. We could work on it on the floor.
Okay, very
Thank
good.
you, sir.
Back on the bill. I understand she's withdrawing all of it. Is that correct?
That's correct.
Okay. Representative Weichel.
Thank you, Mr. Chairman. I just wondered if there might be somebody in the audience who would know whether there's a registry, because I assume this would not be a problem just for schools, right? It would be for anybody with the device. Can we open that up?
Joseph, can you clarify this for us?
Joseph House, Executive Director of the Emergency Medical Services Board. Yes, so there is currently a registry, and yes, a majority of our schools have actually registered the location of their devices within that registry. As we prompted, once we uploaded that electronic system, we reached out to the schools specifically to say, hey, we know that you have these. Here are the instructions to enter and to get those registered as we go on. We anticipate that we'll have to continue to do that as we go on. The registry has been in existence. The electronic registry has only been in existence for roughly about 2 years. The paper notification form has been required, and it has been a shall for since the beginning of the law. So without looking at that, it's been a shall for quite a while.
Very good. Thank you for that. Representative Blex.
Thank you, Mr. Chair. And I would assume if the schools had had a real problem with that, they would have been listed as no opponent, because that word shall's been in there instead of neutral. So I guess they could probably care less. Thank you, Mr. Chair.
Further discussion on the bill. Representative Reed.
And maybe you may answer my question. Is the purpose of the registry so if EMS is dispatched to a particular school, they would also know where the defibrillators are located? Or if they will know that the school even has one?
Mr. Chair, the purpose of the registry is to allow our telecommunicators, so the receiver of the 911 call, when they pick it up, to direct folks there where the nearest AED is at that's available for their use.
Okay. Thank you.
Committee, further discussion. Seeing none, all in favor, say aye. Aye. Opposed, same sign. Bill is passed. Thank you for your due diligence committee here. Again, we will try to do what we can to try to knock down dominoes the rest of the week. We've got a busy schedule. I never can figure out how much debate we're going to have on bills, so we've allowed a certain amount of time. We'll just see how it works out. With that, we're adjourned.